And I'm Izzy.
And I'm Claire.
Our religion is Hinduism, so just as a background statement, in the Hindu faith, the cow is considered to be a sacred animal, and many Hindus are strict vegetarians. So many Hindus, they prefer not to use medications with animal products in them, and this encounter between Izzy and I would be one between a doctor and a Hindu patient about an antibiotic with gelatin capsules, which are made with bovine products. So let's get started. Hi, I'm Dr. Hep. How can I help you today?
Well, I came in because I noticed that my throat's been hurting a lot, especially when I'm like swallowing my food or something, and it's just really sore.
Can you describe like how it feels?
Well, it feels kind of like sandpaper every time I swallow, and it also feels like it's really swollen and
Yeah.
bulging.
Okay. Have you had any other symptoms such as a fever?
Actually, yeah, I've had a pretty high fever for like 3 days.
I'm sorry you had to deal with that. That sounds really uncomfortable. Do you remember how high your fever was?
I think it was about 101.3 last time I checked it.
Okay. Have you had any other symptoms?
Not that I know of.
Okay. Well, if you don't mind, I'll take your temperature again and have a look at your throat, and then I'll just take a listen to your lungs.
Sure.
Okay. So let me grab my thermometer.
Beep beep. Beep beep. Beep.
So 101. So you do have a fever still. And then next I could take a listen to your breathing.
All right.
Let me get my stethoscope. Okay. Take a deep breath. Good. Another one. Okay, one more. Alright. Well, your breathing sounds good. Then lastly, I would like to take a look at your throat.
Sure.
Okay, say ah.
Ah.
It looks like your tonsils are swollen. Do you feel any pain when I put pressure?
Yeah.
Okay. Yeah, your lymph nodes definitely feel a little swollen, especially this one. It's a lot bigger than the other.
Okay.
Okay. So your lungs sounded good, but based on your high temperature and your swollen tonsils, it looks like you probably have strep throat.
Okay.
So in order to treat that, we'll need to put you on an antibiotic.
Okay, sure.
So I'm going to send the pharmacy a prescription for amoxicillin capsules, 500 milligrams. You would take this twice a day for 10 days, and you should start to feel better in just a couple of days, but it's important that you take all the capsules even if you start feeling better earlier.
Okay. Yeah, well, do those capsules contain any animal products? Because I've had some issues with doctors in the past prescribing them medications that have animal products in it, or at least like cow products, and that's against my beliefs as a Hindu,
okay.
so.
I'm sorry about that. Yeah, this prescription, the medication is actually coated in a gelatin capsule, which does contain some bovine products. We do have another dosage form available though. Are you okay with taking a liquid medication?
Yeah, as long as it doesn't contain the animal product, I'm fine with that.
Okay. Yeah, this one does not. It's just a liquid form of the medication, and since it doesn't have the capsule, it doesn't contain any of the animal product.
Okay, good. Can I take that?
Yep, of course. So I'm going to send the pharmacy a prescription for amoxicillin. It's 250 milligrams per 5 milliliters. And you will take 2 teaspoonfuls twice a day for 10 days.
Okay, sure, that sounds great, thanks.
All right, no problem. Have a good rest of your day and let us know if you have any questions.
All right, I will, thank you.
And I'm Claire.
And the religion that we're going to be talking about in this video is Judaism. So
Just as a little bit of background before we get started on the skit is that Jewish faith, in the Jewish faith, they place high value on saving a life, meaning that in emergency situations or life-threatening situations, saving the life of that person becomes the priority, even if it might happen to be on the Sabbath day or on a Jewish holiday, or if it might have interfered with any other beliefs. So this patient encounter is about a heart valve replacement surgery that's occurring later on. They're going to schedule it during the script. So this appointment is happening on a Friday morning between the heart surgeon and the Jewish patient. So we're going to go ahead and get started. Hello, I'm Dr. Euler, and I'm here to talk to you about your heart valve replacement surgery. Now, when a heart valve is not working properly, it's usually standard to repair it or replace it, but given the damage to your heart valve that we found, we think it's the best option to go ahead and replace it just so that we give you the safest option, okay?
Oh, okay.
Alright, now I know this is a lot to take in, but if we do not do the surgery soon, it could have some serious health implications for you, so we should do it as soon as possible. That's what I would recommend.
Okay, well, I guess could you tell me more about the surgery then?
Yeah, so it is a complicated procedure and there are many risks, I'm not gonna lie, but I wouldn't worry. I've done this procedure many times and the surgery takes about 2 to 4 hours to complete. So this surgery involves a replacement of your heart valve, as I said, with a porcelain valve, which will last for about 15 years.
Do you mean porcine as in pig?
Yes, so it is the standard use for this type of surgery. We like to use it because it's been a safe option and it's tend to work well in most patients.
Okay, well, I'm actually Jewish, so would there be any other option for me?
Okay, well, I'm so sorry that I didn't know that, but it is possible to use other options. So another option would be a bovine valve replacement, but it has been studied a little bit less and it can be a bit more complicated. The risk of complications is a little bit higher and the price increase is quite significant. If this didn't work for you, there's another option that would be a mechanical or an artificial heart valve. These tend to last a little bit longer, whereas the bovine and the porcine last for about 15 years. These last longer than that, but they also include more maintenance and they're more pricey as well. So would any of those options work for you?
I mean, I guess I'd go with the bovine if that's okay.
Of course, yeah. I'm just going to need to contact a colleague of mine to come assist with the surgery just because I haven't done as many of them and I don't want to put your health at risk. So, but there's still no need to worry. He is a specialist in this area of replacement, so he'll be there to assist me and to help me with the procedure and make sure it goes smoothly.
Okay, I just have another question too.
Yeah, sure.
So before the surgery, I was wondering if I could be blessed by a rabbi before I go in.
Yeah, sure. There's no problem with that at all. Just have him come in with you when you arrive at the hospital and make sure you get it done at least an hour prior to prepping because we'll need an hour to prep you for the surgery to where we can get you ready to go in. But other than that, we want you to be as comfortable as possible.
Okay.
All right, well, now we need to talk a little bit about scheduling your surgery.
Yeah.
So as I suggested earlier, we need to do it as soon as possible. So we have 7 a.m. tomorrow morning on Saturday, or we can do a 12 noon on Sunday.
Well, Saturdays I usually like to observe my Sabbath day.
Okay.
So I'd rather do it on Sunday at noon, if that's all right.
Yeah, of course we can do that. It is important that we do it as soon as possible, but I don't think the day is going to make much of a difference, especially if it respects your beliefs. So I'm okay with doing it at noon on that day.
Okay.
So yeah, we'll do that. So great. Thank you for your time, and I will see you at your surgery. Now I just want to talk to you a little bit about how the process is going to go.
Okay.
So I need you to arrive about 2 hours before your surgery,
Okay.
and you need to fast 12 hours before and no liquids after midnight the night before.
Okay.
So at midnight on Saturday, just no more liquids. So when you get here, you can do the blessing with the rabbi, and then for the last hour, we can prep you for surgery and take you in. Does that sound good?
Yeah. Yeah.
All right, cool. Do you have any other questions for me?
None that I can think of right now.
All right, well, thank you so much for your time and have a good rest of your day, and I'll see you here on Sunday, okay?
Okay. Thank you.
Thank you.
Hi, my name is Han Farm, and I am here to pick up my new medication, but I have a few questions, so can I talk to a pharmacist, please?
Yeah, my name's Ashlyn and I am the pharmacist here. What can I do for you?
So I am a Buddhist, and I'm just wondering if I'm taking this pill conflict with my religious beliefs. So just want to ask you a few questions.
Of course, I completely understand. What types of questions do you have?
I cannot eat meat, so I'm just wondering, is this pill contain any animal products?
Let me check. Well, the pill we gave you is in a capsule, which is made from animal proteins. So no, the pill that you have is not vegetarian. But I can get it switched to a tablet for you, and then that won't have any animal proteins in it at all, and you'll be fine to take it then.
Thank you very much.
Of
I have
course.
one more question.
Okay.
So I know this is a pain pill, so I'm just worried how is this gonna affect my mind.
Okay. Of course, I understand that mindfulness is a very important part of your religion. You don't need to worry though. This pain pill is very mild and it should not affect your ability to think at all. If anything, it might help you think a little better, just because you won't be focusing on the pain that you're in.
Okay, that is very good to know.
Yes. So do you have any other questions about your new medication?
I don't think so.
All right. Great. So I'll get these switched from a capsule to a tablet for you. That way they'll be vegetarian and you'll be safe to eat them. You're going to take 2 tablets every 4 to 6 hours as needed for pain. And like I mentioned earlier, the medication is not going to have any effect on your ability to think clearly or anything like that. But if you do find that this medication makes you feel tired or groggy or just not yourself, or you think that it is affecting your ability to think, just feel free to call us and we can talk to your doctor and get that switched out to another medication for you.
Okay, I will. Thank you very much.
Of course. If you have any questions, feel free to talk to the pharmacist anytime. You can call, you can stop in, and we'll do what we can for you.
Thank you again.
Have a great day.
You too.
Hi, my name is Ashlyn Haitella. My grandmother's name is Rose Haitella. She's staying in the hospice center. She's in room 213. Are you the doctor taking care of her?
Yes, I am Dr. Pham. What can I do for you?
Well, my grandmother is a practicing Buddhist, and I wanted to talk to you a little bit about her end-of-life care.
What are your concerns?
Well, first of all, I'd like to let you know that meditation is a very important part of her religion, especially as someone reaches the end of their life. Because of that, my grandmother wishes to meditate to prepare herself for the final stages of her life. And I wanted to let you know that she says she does not want any medications that will affect her ability to think clearly or just affect her mind in general.
Okay, that is totally understandable. I will not give her any medication that may affect her mind. I will go and check her time to time to make sure that to know how the medication is affecting her.
Okay, great. Thank you. I really appreciate that.
Any other question or concern you have for me?
Yes. Well, I wanted to talk to you about what happens to her body after she passes. We believe that the soul stays in the body for a period of time after someone dies, and my family would appreciate it if you could just let the body stay where it is for a little bit, because she would like us to perform some religious rites after her passing, and my family wishes to be there for it as well.
Of course, your family just can take as much time as you can need.
Thank you so much. I really appreciate you helping my family through all of this.
Do you have any other question?
I don't think so.
Okay, if you have other questions, just come back here to ask me or on any other nurses here.
Okay, great. Thank you so much.
Have a nice day.
Thank you.
Too.
I'd say your results came back and you've been diagnosed with pneumonia.
Lately, I've been having sharp pain in the chest, fevers, chills, dehydration, fatigue, loss of appetite, clammy skin, and sweating. And I've been breathing super fast. I've had shallow breathing and shortness of breath.
What symptoms have you been experiencing? Do you mind if we take a biopsy of your lung to determine what's wrong?
No, I do not mind a biopsy or an autopsy as long as it does not harm a living organism in the process. I am a Jainist, which means I believe in strict nonviolence. I believe life is precious and that I should harm nothing.
Lab for you. Results came back and you've been diagnosed with pneumonia. Pneumonia is an infection that inflames the air sacs in one or both of your lungs. The air sacs may fill with fluid or pus, causing cough and phlegm, fever, chills, difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. So what's bringing you in here today?
I don't wish to have a vaccine or any antibiotics because I do not wish to harm any living organism that is inside me right now, even if it is deadly.
Sir, if you choose not to pursue a medical option, it is likely that you will die.
If death is the option, I choose to die by fasting. It is my religion that in my time of death, I shall pray and confess my sins. I ask for somebody to come in for a private conversation with me where I can talk about all the bad things that I've done in my life.
I will go find somebody that you can confess your sins to.
I'm here to listen to your sins.
Alright, so it's not a very big sin list, but I stole a dog. It was my neighbor's dog. Never gave it back. I started a fire here in Stambaugh. I've skipped class. I've lied to my parents. I tripped an old lady on her way to church and didn't give her walker back. I kicked a cat, and I've been eating while I was supposed to have been fasting. But that's all my sins.
Alright. He's dead, but I guess his sins are forgiven.
He has passed on. It is time to turn his body over to his family.
Hello everybody, my name is Brooke and our religion is Islam, and I'm going to be playing Basima, who's the patient.
My name is Bonita and my characters are Dr. Nkeme, Dr. Murphy, and the nurse. Background information. In the Islam faith, a female patient would want to be treated with a female healthcare provider. Although hospital gowns must be worn, Muslim patients have to be dressed modestly. In this situation, a Muslim patient is taken to the ER on Ramadan and encounters many conflicts such as being treated by a male physician, medication restrictions, modesty, and dietary restrictions. Scene 1. Basima, a college student, goes to the ER on the start of Ramadan due to a very high fever, abdomen pain, and dizziness. Hello, Basima. My name is Dr. Murphy, and I'll be examining you today. When did you start having these symptoms?
Is there another doctor I can see, particularly a female?
Okay, Basima. How about I page Dr. Nkeme, which is one of our female doctors. She's currently in surgery right now. Until then, I will bring in a nurse, and she will ask you all the questions, and I will just take notes. Will that be okay with you?
Yes, that would be okay. Thank you.
Hello, I'm the nurse, and I'm gonna ask you a couple questions and get off those clothes and get you into a hospital gown.
Do I have to take my clothes off? I would really prefer not to.
It's gonna be really quick, Basima, and then you can put them right back on after the MRI.
Okay, do you know who's gonna be doing the MRI?
It will be me. Hello, Basima. I am Dr. Nkeme.
Hello, Doc. I'm okay with that, but can I keep my hijab on until we get to that room?
Yes, that is perfectly fine. Your MRI results show that you have a severe case of appendicitis, and we will need to operate as soon as possible. Are there any family members you need to call?
I can't have the surgery.
Why is that? That is a very important surgery and things could get worse if not taken care of.
I cannot have IV fluids during this time, but let me call my parents. Hello, Mama? Yeah, I have appendicitis and it's getting really bad. And I have to use IV fluids for surgery and I don't know what to do. Yeah. Okay, I'll see you soon. Bye. So I will do it, but I would have to make up the days I missed.
Okay, that's good to hear. Have you eaten anything today?
No, I have not and cannot till sunset. Who will be in the operating room, Dr. Nkeme?
I will make sure it's all female nurses and myself, but unfortunately, all our anesthesiologists are male and will that be okay? They won't be in any direct contact with you.
That's fine, but right after my surgery is done, can you make sure my hijab is put back on before I leave the operating room?
Yes, I'll make sure of that, Basima. Do you have any other restrictions I should know about?
I cannot have anything pork or alcohol containing.
All right.